This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, September 2nd, and I'm Zach Caruso. Our lead story this week is from JAMA Network Open and is titled Recommendations for Addressing In-Hospital Substance Use from a National Delphi Consensus Process. This survey study utilized a 3-round Delphi consensus process to identify best practices for addressing in-hospital substance use. A panel of 38 addiction experts developed 84 consensus-based and patient-centered recommendations which can inform local responses, including policies, to address in-hospital substance use. Next is an article in JAMA Network Open titled Hospital-Wide Implementation, Clinical Outcomes, and Safety of Phenobarbital for Alcohol Withdrawal. This is a quality improvement study comparing outcomes before and after implementation of a phenobarbital electronic health record order set for the treatment of alcohol withdrawal syndrome, or AWS, in a community hospital in Seattle. Notably, the study was conducted in a hospital where the majority of hospitalists had no prior experience using phenobarbital for AWS. Researchers compared outcomes for 154 patients before implementation of the order set to 100 patients afterwards. Main findings included faster symptom resolution, reduced AWS treatment duration, and decreased length of hospital stay. There was no increase in adverse events. Next is a study in drug and alcohol dependence titled Time from Waking to First Cigarette, Accelerated Biological Aging and Risk of Premature Mortality. Time from waking to first cigarette, or TWFC, has been used as a measure of nicotine dependence. For this study, which used data from the UK Biobank, researchers calculated biological age using 2 validated methods that use a panel of laboratory values to estimate biological age. A shorter TWFC was associated with increased premature mortality. Compared to never smokers, the premature mortality hazard ratio for TWFC greater than 2 hours was 1.45, and for TWFC less than 5 minutes was 2.54. TWFC was also associated with accelerated biological aging, which the authors estimate mediated 10 to 25% of the association of TWFC and premature mortality. Our next article is in the Annals of Internal Medicine and is titled High Concentration Delta-9 Tetrahydrocannabinol Cannabis Products and Mental Health Outcomes, a Systematic Review. Changes in legal status of cannabis have been associated with an increase in high-concentration THC cannabis products. In the systematic review, researchers included 99 studies to evaluate association between high-concentration THC and anxiety, depression, psychosis, or schizophrenia, and cannabis use disorder, or CUD. Overall, the authors found a consistent unfavorable association between these products and psychosis or schizophrenia and CUD. The association between these products and anxiety and depression was more mixed between favorable and unfavorable outcomes, with limited evidence of therapeutic benefits. Next is a study in the Journal of Substance Use and Addiction Treatment titled The Effects of Psychostimulant Prescription on Opioid Use Disorder Among People with Co-Occurring ADHD. This retrospective cohort study utilized commercial claims data to assess outcomes for patients with concurrent ADHD and OUD diagnoses. The sample included 10,000 individuals with both ADHD and OUD who initiated treatment with buprenorphine between 2011 and 2021. Of this group, 5,100 also received psychostimulant prescriptions, while 5,500 did not. The study found that individuals who received psychostimulants had lower odds of buprenorphine discontinuation and opioid-related hospitalization. Additionally, increased fill count of psychostimulant prescriptions was associated with a lower rate of opioid-related hospitalization. Our next article is in PLOS ONE and is titled Global Burden of Disease Due to Opioid, Amphetamine, Cocaine, and Cannabis Use Disorders, 1990 to 2021, a systematic analysis for the Global Burden of Disease Study 2021. This paper reports on the global burden of disease due to drug use disorders, or DUD, in 2021 and trends since 1990. Over this period, the overall incidence rate of DUD decreased by 8% to 169 per 100,000 in 2021. However, the number of deaths from DUD increased by 122% since 1990. The greatest increase was for cocaine, followed by opioids and amphetamines. Opioids were responsible for the highest number of deaths. North America had a DUD mortality rate that was 11 times the global mortality rate, and in 2019, the United States accounted for more than half of the global DUD mortality. These results show rising mortality due to DUD despite a modest decrease in incidence. Next is an article in Alcohol Clinical and Experimental Research titled Discontinuation of Treatment for Alcohol Use Disorder During Pregnancy and Postpartum in the United States. Using combined commercial and Medicaid claims data, researchers examined AUD treatment during pregnancy and postpartum. Researchers compared women with AUD receiving MAUD or psychosocial interventions or PSY who became pregnant to a matched group of non-pregnant women. Findings showed a significant decrease in MAUD during pregnancy from 12% preconception to 0.3% during third trimester. Further, few of the women restarted MAUD in the postpartum period. In an adjusted model, pregnant women were much more likely to discontinue MAUD than non-pregnant peers, but not PSY. These findings highlight that this population may need targeted intervention to be retained in AUD treatment and to potentially resume MAUD in the postpartum period. Our final article is in the Journal of Addiction Medicine and is titled Parental Literacy on Adolescent Substance Use, a Crucial Yet Overlooked Factor. This commentary explores the importance of parental substance use or SU literacy, the obstacles impeding it, and possible strategies to enhance parental awareness. Many parents encounter difficulties in recognizing symptoms, often misjudge the risks associated with occasional substance use or compulsive behaviors, and are unsure about where to seek reliable support. In addition, stigma, misinformation, and a lack of accessible resources further hinder parents' ability to take timely action. Strategies to enhance parental SU literacy are discussed, aiming not only to promote early detection and intervention, but also to reduce the long-term societal burden of adolescent SU. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.